good afternoon, everybody who's joined in so far. I know we'll have more attendees who are funneling in here as the conversation goes on, but I wanted to get started a little bit earlier today, just because our presenter today, Dr. David Matson from Roswell Park, really has an important discussion. And as you saw by the title, the lessons learned from COVID-19 and the path towards improved Indigenous communities' health landscape. We're going to take a different approach to the discussion today, a little less formal, a bit more casual, but also covering some really paramount topics in our Indigenous communities. David and I have sat down behind the scenes and had some lengthy discussions about what today's talk would be about. And we felt that it was important we focused on not only the challenges, because there are many of which we're aware of and we've heard in the news and social media, but also the successes. And talking to our respective communities, both in Hawaii and the Haudenosaunee Nation here in New York State, we realized there's actually been many success stories that we wanted to highlight through this discussion and provide some context of hope, inspiration, empowerment for our collective health versus focusing solely on the health disparity, which we hear so often about. So this is a brief introduction, and I'm going to let David take over from here. But David he's a close friend of the center. We have worked on many projects, both at Roswell and beyond. And David has shown our group from the very beginning much needed support and provided his expertise as a clinician. So as researchers, we don't all have a clinical background. So David is our clinical eyes within the Roswell Park Center for Indigenous Cancer Research. So we respect his opinion as a clinician and a doctor, as well as a collaborator with the Center for Indigenous Cancer Research. So David, I'm going to take off. I'm going to loosen the tie a little bit, and we're going to maybe have a more casual discussion here, but maybe you can provide some more context and background, both academically and personally, about yourself for our viewers today.
There we go. Thank you so much, Will, and welcome everybody to this webinar discussion. So I'm Dr. David Matson. I'm a native Hawaiian, born and raised in Hawaii, and actually educated all the way through medical school in Hawaii before leaving and pursuing my career in radiation oncology. I did a year of surgical internship in Syracuse before doing some research in radiation oncology at the NIH in Bethesda, Maryland. Excuse me. Following that, I did residency in Iowa before coming here to practice radiation oncology as an attending physician, where I've been for the last 13 years, since 2008. Going back a little further, in grade school, I attended a high school that was founded through the trust of a woman in one of the last monarchs of Hawaii, Princess Bernice Pauahi Bishop, who established the Kamehameha schools, where I attended from kindergarten through senior year. And there I got a lot of experience and exposure to the Hawaiian culture. During medical school, I spent some time exploring the medicinal aspects of Hawaiian culture and how health was impacted through historical events in Hawaii. And fast forward to now, I'm involved with the CICR and have been working with Rodney and Will and the other members of CICR since even before CICR was established, and they've been fantastic collaborators and colleagues, and we're doing a lot of, I think, really important work for the Indigenous community, both central to healthcare, as well as some projects that expand a little bit outside of healthcare, but still very important and relevant to the overall health, if not physical, spiritual health of our Indigenous communities. Thanks, Will. Will,
Let's try that. Let's try that again. Sorry, David.
okay.
So with your experience as a clinician, what are some of the disparities that you have noted, and as well as your research you've noted in our Indigenous communities during COVID-19 and the subsequent vaccination process?
Well, I think broadly speaking, it's been, long recognized and many layers of programs and projects and efforts to addressing inequalities and social determinants of health. Those would include food insecurity, sanitation, income insecurity, healthcare disparities in terms of access to healthcare, and the quality of healthcare that people have access to. Specific to the Hawaiian culture, there's a greater proportion of we'll call it indigenous in Hawaii that live really separated from tertiary healthcare facilities, particularly on neighbor islands where it is an endeavor to travel to get tertiary level care should that be needed, and there's a greater proportion of Native Hawaiians who live in these neighbor islands and less connected areas than non-Native Hawaiians in the state. Now that's just one example, and in addition to being having these geographic limitations, there's also a recognized I guess inadequacy of funding to some extent. For instance, the number of ventilators during the COVID era that would be available at a hospital or a clinic on a neighbor island, obviously would be very low, and should individuals require that higher level of care and require being intubated, it would actually be important for them to be transferred to the main island of Oahu in order to get access to that kind of care.
So beyond the logistical challenges that I think a lot of our rural Indigenous communities, both in Hawaii and North America, face, could you speak a little bit on the comorbidities experienced in Indigenous communities and how this impacted our communities during the COVID-19 pandemic?
Sure. Yeah, there's a long list of examples and a lot of papers and data that have been that are out that describe these say I guess determinants of health with regard to an individual's health. So among indigenous populations and indigenous communities, it's well known that there is greater incidences of things such as coronary heart disease, diabetes, and asthma. And it's definitely the case in the Native Hawaiian community as well, where there's, about 50% greater incidence of these things. And just to throw out some numbers, for diabetes, about 13.3% of Native Hawaiians have a diagnosis of diabetes, compared to about 8.1% in the non-Native Hawaiian community in Hawaii. So, while these numbers are higher, it just underscores part of the bigger problem, because with these comorbidities, we know that they place individuals at greater risk for morbidity and even mortality if they were to contract COVID-19. We've seen that in all populations and in all peoples, and of course those who do have these comorbidities are at greater risk. And of course, if we delve deeper into the topic of comorbidities, the question would arise, well, why are these, why are there greater rates or higher rates of coronary heart disease, diabetes, and asthma in Indigenous populations? And there's the answer isn't simple. There's a lot of layers to it. In addition to interruption of cultural practices, economic insecurity, and not I guess poor access to healthy food options. Those sorts of things are part of the reason why there are higher rates of comorbidities in Indigenous populations that put us and our people at risk for worse outcomes in the COVID era.
And for our audience who maybe not completely familiar with the term comorbidity, it's essentially, David, you can correct me here, but essentially it's multiple health conditions. It's multiple sort of layered health conditions that someone may experience if they're diabetic, may also experience high blood pressure, may also experience a myriad of other conditions that really strain the biological systems in the body. And we know that COVID seems to be an opportunist in these situations when a body is or individuals experience these conditions was already somewhat weakened, chronically weakened. That seems to be the opportunity when the COVID-19 virus takes hold and can really cause a lot of problems. And so, so now let's turn the corner just a little bit now. We've laid out some of the disparities, which our audience may be familiar with, maybe not, but we certainly know that Native Americans have been disproportionately affected compared to other ethnicities during the COVID-19 pandemic, both in incidence and morbidity. The number of people have died. Let's turn this corner a little bit and talk about some of the successes. We've sort of established some of the challenges. What are some successes that you've noted? And after you've given your synopsis, Sarah, I'll add mine as well. As a community relations coordinator, I get the opportunity to talk to our community directly, our community health centers, our community physicians and frontline workers. And I've heard some really interesting stories. So I'll let you share first what you've heard, what you've seen, and information you've gathered about some of the successes or some of the evolution of healthcare that has started to develop because of the challenges of COVID-19.
Sure, absolutely. So I will preface this by saying that the successes that I'll mention are based or originate out of challenges that were faced. So, for instance, with a lack of central leadership on the national level, I mean, that together with messaging that can be sometimes inconsistent, where national committees or groups may lay out guidelines that aren't consistently followed, it could lead to some confusion and some, I guess, maybe a lack of trust or other things. However, there's examples of how local communities, Indigenous communities, nations have stepped up and taken the lead. One example is with regard to one of the social determinants of health, physical distancing. In our communities with crowded multi-generational households and with individuals who may be essential workers and at risk for exposure through their occupation and bringing it home. There have been some examples of voluntary isolation where the Atawapiskat, I believe, First Nation, I think that's how you pronounce it. They described how they just took it upon themselves to go out into the wilderness and secure their borders and live without being exposed to other people. There's also been lockdowns of reservations and closing borders and imposing blockades to control access and imposing curfews, which is an example that the Navajo Nation has described In New Zealand, in the Maori culture, one of the things that they did was using a cultural perspective to do this, they imposed a rahui, which is a temporary ban on a greeting practice called hongi. And there's a similar practice in the Native Hawaiian culture as well, where two individuals would press their noses together and share breath. So we would press our noses together, exhale, and as our breaths mix, we'd inhale. And of course, during the era of COVID, we all know that is not a good thing to do. But using the cultural context and cultural language in order to impress upon the community the importance of the temporary ban on this a way of showing respect and greeting each other helps with the adoption of these measures. And there are other examples of with social distancing and income inequality and challenges with having to get food. There's been examples of nations and groups within them starting collection drives, fundraisers, and actually using those monies to buy food and water and other needed supplies and delivering them, across their community in order to allow those individuals who are at greater risk, particularly the elderly, shelter in place and not have to go out to supermarkets and other things like that. So those are a few of many examples of things that are being done. Actually, there's one more that I thought would be interesting and worth mentioning. In Hawaii, for instance, this was back in late March. OHA, or the Office of Hawaiian Affairs, organized a Native Hawaiian, group of community leaders to come together to discuss resource availability, allocation of these resources, and particularly that in the context of anticipated need with the developing pandemic. And so a number of organizations, prominent organizations in the community, namely the Queens Medical Center, which is the largest healthcare provider in the state, and another entity that arose from the trust of one of the last ali'i or monarchy within Hawaii. They were involved, as well as the Kamehameha School's Bishop Estate, which is the estate and the trust that helped establish the school that I attended, that I mentioned earlier. But it's that kind of thing, together with state legislators coming together and really stepping up to help the community and to make sure that if federal funds weren't sufficient, or if guidelines or guidance with regard to travel limitations and that sort of thing weren't sufficient, then they had a good sense of what they as a state and a community would need to do in order to keep them and their people safe.
Those are great examples. And I think what really was humbling to me was to see how quickly tribal communities had come together during the pandemic collectively, to see how quickly they came to action and provided these services and filled in some of these obvious voids in healthcare on their own. And you had mentioned sort of this almost this voluntary call to action. Individuals from our communities weren't waiting around. They were taking action on their own. And traditionally, and I would say this is probably the case in most Indigenous cultures, but certainly in Haudenosaunee, is a sense of personal responsibility. Your health is a personal responsibility to your community. And that's what I saw. That's what I was seeing, this revitalization that, okay, my health matters not just to me, but the people around me now. And this is a value that's deeply embedded in our respective cultures. And I know from the beginning, CICR's own Dr. Herring was part of these federal advisory committees when the government and pharmaceutical companies were developing clinical trials, and it was imperative that the Indigenous voice was brought to the table during the development of these clinical trials. Because as we know, oftentimes research and Indigenous culture don't always blend very well. Sometimes there's some polarizing viewpoints, and this can make it very difficult to have that Native voice on the table, and make it very challenging to include Native Americans or Indigenous people from all across the world to be included in research. So from the beginning, CICR was actively involved in ensuring that when clinical trials were developed, that they took in consideration the needs of our Indigenous communities, which is often much different than other communities. I'm sure other communities could say that as well. So, and subsequently, as the vaccinations became available to the public, I know that in our local communities, the healthcare systems had the ability to vaccinate every single person, every single member of the health clinics. Not everybody obviously has chosen to do that, but at least there was availability. Now, in contrast, in the same communities, the non-Native folks who are interested in the vaccine had a much more difficult time accessing that, often traveling 3, 4, 5, 6, I even heard 8 hours one way to receive their COVID-19 vaccinations. And so in that respect, I saw a major shift in how our local Indigenous communities were accessing care and those vaccines. So those are some of the highlights. Some of the highlights we've seen here locally and abroad. And I hate to say it, but it seems like in most cases, it takes some type of crisis for people to wake up and take action when it comes to our health. We often take our health for granted. And this is a period when we simply didn't have that luxury of taking our health for granted. People of all ages are being affected, although we certainly saw a pattern. And let's talk a little bit about that pattern. And this kind of ties in with the coexisting conditions, but it was very obvious that our elders were being greatly affected across the country, Native and non-Native. Our elder communities, seniors, are being disproportionately affected by COVID-19. Can you speak on that a little bit, David, maybe from a clinical perspective, and what do you feel based on your research, there's some of the reasons for that were?
Well, so I guess there's a few different ways to approach this. I mean, age in and of itself is a pre-existing condition, a complicating factor that, like you pointed out, the comorbidities of heart disease, diabetes, lung disease, like asthma and such, do predispose they predispose individuals to morbidities from COVID. But I think that theme is, and not to digress too much, but that's a theme that I think we see in many aspects of this pandemic, is that just underlying challenges that individuals face, whether it's in a socioeconomic sense, whether it's in a personal health situation sense, really come to a head during the pandemic and the stresses that it imposes. With regard to elders, the way that I look at it from a medical perspective is, there's higher levels of care needs for our kupuna. It's what we call our elders, our respected elders in our community, our grandparents. And in a normal sense, we can tend to those. But when there's times of added stress crisis, then it's all the more important to increase the amount of effort we take to providing them what they need, to doing what we can to make sure that they're protected from threats like a COVID-19 infection. And I think that, well, I'll put it this way. I think that indigenous cultures like ours and the Native Americans really do place our elders in higher regard and higher esteem. And for that reason, I think that it's not uncommon to see that we put forth additional effort to make sure that they're protected and that they're safe, and that if there's anything that they need, that we make sure that we're there for them to provide that. And so that's that. I guess that's kind of the point that I wanted to make, is that there are greater risks and challenges, but indigenous communities do go to greater lengths to make sure that we keep these people who are very, very much important to us, our repositories of cultural and ancestral knowledge, with us as long as we can.
Well, I think that was going to be my next point, David, is I often emphasize that, ironically, when we look throughout our traditional knowledge and our traditional healers, that oftentimes for generations, our ancestors have found a way to embed this knowledge in a way that's relevant today in 2021. And you mentioned that we hold our elders to a higher regard. In that sense, I think I would consider that a success during COVID-19, because we already had an embedded sense of priority on our elders, is that we were prepared. We were more prepared than I think other communities were for this type of pandemic, because of the care already taken for our elders. And I often cite some of the research and literature that shows that non-pharmaceutical based interventions have been effective for prevention or the severity of COVID-19 or the recovery from COVID-19. And we're seeing that stress reduction and nutrition, support, all of these things that are traditional indigenous values are of high value during a pandemic. And so protecting our elders, or as we call them, the wisdom keepers, is really an important is really a top priority. And I think from these discussions that David and I have had with CICR and other team members, and I'll just make a side note of this, not to get too off track, but David developed the Wisdom Keepers Heritage Program in an effort to seeing the stressors placed on our elder community during COVID-19. The Wisdom Keeper Heritage Program is an opportunity to give our elders, our wisdom keepers, all this wonderful knowledge that has helped our communities during the pandemic, a proper platform, a place at the table, as I mentioned before, where their voices can be heard. And I think in some ways, especially statistically, there's been disparaging ways of referring to our elders. Well, if you're not 60 or 65 or 70, whatever the number they're throwing out, if you're not in that age group, you're safe. It doesn't really matter. Almost, sort of just dismissing the fact that these people who are 60, 70, 80 years old, who are being disproportionately affected, are people, and so we wanted to. And David wanted to bring that to light and honor our elders, as opposed to just making them a side note or a footnote in research somewhere. So we want to, thank David for starting that program and asking CICR to be part of that initiative. And so I think we're kind of weaving our way through this conversation a little bit, hopefully in a way that makes sense for our audience. It's not exactly a conversation to have, and we want to share to be uplifting as much as possible. But I think it's important that we don't completely sugarcoat everything. And I'd like to talk about systemic racism as a whole. And it was a very polarizing conversation in different communities, not just the Indigenous community. But could you speak on that subject a little bit, David, and how racism, systemic racism specifically, had an impact on the delivery of care and outcomes during the COVID-19 pandemic?
Sure. So that those systemic challenges, the stigma, some call it, discrimination, is the way that it's described in other circles, is real, and it exists, and it does present a challenge to not only providing healthcare, but receiving healthcare as an Indigenous person, patient. There's I was trying to think of a good example, in my history, but the best that I could come up was this story. So when I was younger, high school age, I was part of this youth group where there was a non-native Hawaiian group leader, and he was talking and telling us about a subject or a topic, and I was listening to him attentively because it was interesting, taking in every word, and I got a lot out of the message that he was sharing. So after he was done talking, he came up to me and he asked, why I wasn't listening to him. And, he said that it seemed like I was very disinterested in what he was saying. And at first I didn't realize what he meant because I was listening to every word. Well, what he said was, well, you weren't looking me in the eye when I was talking to you. You were looking at the ground. And, it's just not, maybe it was partially to not show disrespect and to directly look him in the eye. But it was also just a comfortable way for me to listen. And so, I told him I was listening. I really was. So he asked me, so what did I talk about? What were some of the things that I was saying? So, I detailed for him exactly what he was saying and what I thought about it. And then he backed off and he realized that, there are different ways of taking in information. And I think that, the point of that story was that, as a healthcare provider, although the patient in front of me from a different culture may not be giving me the nonverbal and verbal cues that they're understanding the information that I'm providing, or the implications of the diagnosis or the treatment, it doesn't mean that they don't understand what's going on, and it doesn't mean that they're by extension incapable of digesting that information and making informed decisions about their care, whether I agree with their decisions or not. But I think that that's an important thing for healthcare providers to recognize and to be able to work through. And one of the dangers, I think, beyond the misunderstanding or lack of understanding, would be what might happen next. A healthcare provider may feel like, well, I've got another a long line of patients that I have to get to, so why don't I just tell this person what we're going to do, whether they agree with it or not. This is a medicine I'm giving you, and here's a prescription. Take 2 aspirin and call me in the morning if you're not better or something. And I think that there's at the very least missed opportunities there, and at the very most, it could be compromising care, definitely compromising a relationship there with these barriers that arise.
It would seem that the crisis that was certainly the foundation of the COVID-19 would make it very difficult for a well-intended physician or any healthcare worker to do their absolute best at totally understanding what that individual needs from a cultural perspective, or having the luxury of time. And so I think that it's almost like the medical system is set up for failure in that regard, because it's so high paced, and physicians often don't get enough time. It's not by personal choice, but a product of the system. And that time spent is critical for developing relationships. And I know that working at previous work, that one-on-one time that I had the luxury of spending with our community members was essential for me being able to assist individuals in their personal health and wellness. Without it, there's no way I could have made those strong connections in 5 or 10 minutes, like oftentimes physicians get. So looking forward, David, let me ask you the $1 million question. Do you think that the products of COVID-19 will prepare Indigenous communities for a healthier future?
So you're wondering if our experience with COVID-19 would help us be better going forward?
Yeah, be better prepared for, let's not, maybe let's not say similar situations, it's too early for that, but in the event that something, a crisis like this developed, do you think that we would be better prepared in our respective communities?
Well, I'll say, well, it depends what we do about, it depends what we do with the knowledge we've gained and the lessons we've learned. If we take them and we, implement the measures that we know are important the next time a pandemic occurs, and it inevitably will, whether it's in 5 years, 20 years, or 100 years. Taking the lessons we've learned, including understanding that comorbidities, and I use that in the general sense because it could relate to health comorbidities, it could relate to social determinants of health, and cultural determinants of health, and those sort of things, where there are clear inequalities, inequities, and so forth that can and should be improved. If we take the time now, or well, I should say, once this pandemic is over and things become more normalized, and we've got more flexibility to work hard to improve housing and water and food security, income and wealth equality, health equality, criminal justice, measures, and so on and so forth, then I think that we'll be better prepared with more buffer, as I sometimes call it, in order to weather the next pandemic that comes through. So I think that there's a lot of useful lessons learned from what our weaknesses are, or what our challenges are, and what some of the things that worked well for us this time are, that we can have in place to activate the next time something like this happens.
I just wanted to mention that one of the successes, and I'll go back to the success discussion that we had, that I noted, and I think will be really front and center moving forward, is the transparency that what I was observing. The transparency and the relationship developed between, say, tribal government and the local, the tribal, the local, state, and federal governments, and saw this a much stronger, transparent relationship coming out to the public and flat out saying, this is what's going on. These are the numbers. Here's what we have available. These are some of the guidelines we have in place. Let us know if you have any questions. Here are some hotlines to call if you're concerned, or here's these resources. It was black and white. It was very simple, straightforward. And man, what a success that is. Coming from a place when there's sometimes a fractured relationship between those entities, between government and healthcare. It seemed like everybody was joining together, and regardless of ethnicity, regardless of background or location, everybody was coming together. And let's hope that stays in place. Let's hope we maintain that same transparency and that strong relationship from the government and our leadership down to our community members. I feel that will be the case. I really do feel that way. It's something positive that has come out of the COVID-19 pandemic. So for our attendees, we are starting to wind down on our discussion here today. If you have any questions for David, feel free to put them in the chat box. We'll be sure to get to everyone today. And David, as we wind down, I have a couple of additional questions.
Sure.
I feel strongly, and this is just a feeling. I don't want to get into hypotheses or bias or anything like that, but I've seen some objective movement toward a stronger and healthier future for our communities.
Mm-hmm.
I hold on very tightly, maybe sometimes to a fault, that Indigenous knowledge can have an incredible impact on the amount of suffering, whether it be a pandemic or everyday daily life. And I often outline exercise or movement and food because this is my background before coming to Roswell Park. And a lot of our teams at Roswell Park focus on the benefits of movement and exercise, spirituality, mindfulness, things or aspects of Indigenous life that were not really, these were not strange. These were everyday commitments to health and wellness. So, and I'm going to ask a personal question or opinion. So
Sure.
We don't need to maybe delve into research or anything like that. But do you feel that traditional knowledge and central knowledge from our respective Indigenous communities holds the key, or at least can be part of the overall solution, how we weather these storms in the future, how we bolster up both the health of the individual and the community, or do we just sit back and maybe hope for the best?
I would answer that with an emphatic yes, that I truly believe that there's value in Indigenous knowledge. Exactly to what extent, it's hard to see, and I think it depends on the situation that we're talking about. But whether it be patients who I treat, I encourage them to share with me if they're doing anything in line with or in parallel to the treatments that I'm providing. And I certainly unless there's clear evidence that what they're doing may diminish the impact of the treatment we're delivering, I do not discourage them from engaging in their cultural practices or complementary medicinal things that they're taking. I think that there's a lot that we don't know about it. There's a lot, for some, that we do know. There's a lot that we don't, and just because we can't necessarily prove that it works doesn't mean that there's no value in it, because there's different layers of healing and medicinal applications, whether it's physical healing or spiritual healing, and sometimes the spiritual healing may make all the difference, especially if Western medicine fails, and in those situations I think that I'm glad that there's cultural and Indigenous things, medicine that some people have available to them.
And the irony in my community outreach and education hat that I put on is there are many cancer drugs that were derived from traditional Indigenous plants. Mm-hmm. Certainly not now in their whole form, but the Indigenous knowledge has been used for generations from people of all backgrounds. In the case of allopathic or conventional medicine, they've even noted that there's value in traditional knowledge. And I think that's a very that's such a humbling concept, that although it seems at times like, I'm speaking only on my behalf, it feels at times
That's a good point.
The culture is often pressed, and it's allopathic medicine often takes favor, and oftentimes for good reason. I told you recently that I injured my finger. I had a bad accident with a knife, and I don't think there was anything that was going to stitch me back together except for going to the emergency room and get stitches. There wasn't anything, essential oils or salves I could have pulled out that would have helped. So I think that at the end of the day, this symbiotic relationship or existence with conventional and ancestral knowledge has a place. And I think it provides some of the best potential outcomes based on, and not based on my bias, but based on the existing literature as well. As the combining of these two methodologies or perspectives can really offer people with both cancer and COVID-19 or whatever the condition may be, the best possible outcome. So yeah, we'll wait to get a few of these questions into the chat box here. David, do you have any remarks or final remarks that you'd like to discuss or?
No, I think that they're just whenever I think about COVID and I try and put it into perspective, broadly speaking, this extends beyond Indigenous communities. I mean, it was what continues to be a significant, challenge for us as Americans. With the daily case average, in the 55,000 range of new diagnoses every day, and still about 1,000 Americans are dying of COVID. It's still very important that we do everything we can to maintain the measures to protect ourselves and those who are important to us, mask wearing, hand washing, maintaining physical distance, social distance, that sort of thing, receiving the vaccinations when available, because last I checked, we were at about 16% of the country that's been fully vaccinated. And in order to reach herd immunity, we're looking at about 80%. And based on the rate of vaccinations as it stands now anyway, we're getting about 2% or so of the country vaccinated every week. So multiplying that out to get us from 16% to 80% would be still, the better part of a year, about 7 months and change. So it's we've still got a long ways to go before we can really, feel comfortable about, dialing things back in the broader sense. And in the meantime, all these safety measures are still very important. So I would hope that we're all still, as much COVID fatigue as we're all experiencing. I'm hoping that we can still maintain reasonable safeguards in place to get this thing over with as soon as possible and get it behind us, so we can move forward.
Yeah, and that's a really great point, is that, we're not out of the woods yet. And sometimes it feels like we have no control or influence, but between, personal care, taking care of ourselves, taking care of others, maintaining all of the guidelines recommended by our governments and the vaccination. We have tools now that we didn't have before to start making progress. So we each feel like we have more control, we have less anxiety, and we begin to recover, heal, and ultimately move forward. But we're not quite there yet. So it's important to reiterate that we're talking about the future in a contextual sense, but we're not quite there yet. David, and I also wanted to mention this too, as an oncologist, what would be your advice for a cancer patient who is attempting to be beyond just the obvious, being vaccinated? What would you recommend to a cancer patient who is concerned about the risk for COVID-19? What are some recommendations you'd give that individual for taking care of themselves? Or what information would you give to their caregivers who are helping to take care of them? What are some additional steps an individual who has cancer can take to protect themselves against COVID-19?
So, I think that there are a few groups or subgroups within the oncology population who are at slightly greater risk of contracting COVID-19. I mean, all pre-existing comorbidities aside, those whose cancer treatments are designed to impair their immune system, those individuals, could be at greater risk. So certainly be far more diligent about maintaining those health measures with masks and hand washing and social distancing. But I think that those safeguards, in and of themselves, can really get us far. Um,
Mhm.
you know, cancer patients as well as just the general population. If we were all to go on lockdown right now, COVID would disappear shortly. Maybe in a couple of weeks to a month, there wouldn't be any opportunity for it to move from one host to another if we're all just kind of hunkered down in our homes and aren't interacting. And obviously, it would have to be done in the pure sense, which is just more wishful thinking than anything. But on an individual basis, if someone was at greater risk or had the opportunity to self isolate like that, they'd be in a much better position, risk wise or safety wise from COVID.
Great. We always like to make sure that throughout these discussion, we go beyond research and try to provide our listeners with some practical advice. And I think we've done a fairly good job today of providing some practical advice, pragmatic advice for folks who are, they want the information, but they want to feel like I need to have some control here. And I know many instances where I've had friends and family just were completely overwhelmed during the pandemic because our lives were changed forever, which leads me to my final wrap-up question. Are our lives changed forever? Are things going to be the same in your eyes? Are they going to be drastically different? Can we expect some sense of normalcy, or is this what we're stuck with? Is this what we have to look forward to the rest of our lives? What do you think, David?
you know so I think the word pragmatic is something that would describe me pretty well. It's never going to be the same. There's going to be a new normal that I hope is a lot like what we had before. But having said that, I think there's a lot of changes that we've seen and we've experienced that could that if we really take the heart and adopt, our lives would be better for it. One just very quick example is what we're doing right now, online meeting. I've got friends and family back in Hawaii who I don't who I used to see whenever I'd fly back to Hawaii, and I do that a few times every year. But now with COVID, I've got my own Zoom license, and I meet with them practically every week, and in some cases several times a week, which is really nice. And I've said I've seen my family and my friends especially way more during the pandemic, over the course of a year than I did even when I flew to Hawaii and visited them in person. So I really like that. If we focus on these things, I think that it would be it would be advantageous and enhance our lives if we embrace it, if we embrace those things.
I think that's a perfect way to wrap up today's discussion. Dr. Matson, is if we embrace it, we have a brighter future to look forward to. And I think that whether we want to or not, we have to adapt, and that's not a bad thing. And I know that from personal experience with great challenges and crisis, sometimes suffering can come a much stronger resolve and a more resilient community. And I'm of the belief, maybe it's just the optimist in me, but I'm of the belief that we will overcome this in some way, as we always do, as a collective Indigenous community. We've mentioned several examples of that today, many successes and triumphs during the pandemic. So I wanted to thank all of our attendees today. And this will be recorded, so it will be available on the Roswell Park Greater website. You can also search in the Roswell Park Center for Indigenous Cancer Research, and you can find links to our next webinar, registration links to our next webinar, as well as all the webinars we've recorded up to this point on our YouTube channel. And also be on the lookout for our podcast. We have another program which we do since we have so many wonderful speakers in our communities. That's trickled down into our podcast. So go on the CICR website and you can check out both links to the podcast and the webinar. So thank you, Dr. Matson, for your insight today. It's very much appreciated.
Thank you so much, Will, for having me.
Likewise. Take care, everybody.